So Thanksgiving is a time for family to get together. It's also a really good time to discuss some important things regarding our loved ones. Perhaps you, a parent, grandparent, or friend, is having to make some very important decisions right now, such as decisions with Medicare. So we want to welcome back Joanne Giardini-Russell and Courtney Ventrone from our partners Senior Health Medicare to help us out. Now, hey viewers out there, you might want to have a pen and paper handy for some very important information in a minute. But why is this, Joanne and Courtney, welcome, why is this an important time for Medicare decisions?
It's chaos. It's absolute chaos. It's the annual election period for people. There's 60 million people in our country that are changing plans potentially and talking to us. So we are slammed. We're open now. You can call. But really critical time to call in and get that 30-minute conversation going. So in case you do want to change plans, you got to do it now.
All right, so we've got a bit of a trivia game in hopes of making it easier to understand the decisions regarding Medicare. And we invite our viewers to play along. We call this Medicare Myth or Truth. And you are going to put all of us and me and our viewers to the test, right?
We're getting better.
All right.
Better every month.
All right.
Awesome. Question 1, health insurance when you are under 65 years old is very similar to Medicare coverage in terms of pricing, coverage, and networks.
Health insurance under 60 is similar to Medicare. I'm going to say false.
You put up
You're
truth.
Saying, oh, I did. Sorry. Myth.
Yeah.
It's a myth.
It is absolutely a myth.
Okay.
It is such a completely different animal. When you are over 65, we spend a lot of time actually trying to unbrainwash people out of the group insurance days because it's different in terms of pricing. Networks, you don't need to be in networks. You can go to doctors of your choice potentially. It is completely different. So important to understand the vast differences and kind of get out of that group mindset mentality.
Okay,
so,
let's start now. What's question number 2?
Okay, question number 2. If you have an existing Medigap contract that is being phased out by the government, you can keep your plan. True or false?
I'm going to say that's a myth.
It's actually true.
Really?
You can, however, you wouldn't want to in most cases.
Okay.
For example, Plan F, high deductible F, and Plan C are going away in 2020. It's 3 years down the road, but we're telling our clients to get out now because you would have to qualify for health to get out of those plans after 2020. Plus, there's no new people coming into that pool, which means, they're going to get older, sicker, claims are going to go up, which means your premium rate is going to go up immensely. So we're advising all of our clients to get out while they still can, while they can now. Call into our office, we'll make it easy for you, and we can help with that.
Get you on track. All right, next question.
Yeah, last question here is, it is mandatory in the United States to sign up for Medicare when you become 65 years old.
Mandatory?
Mandatory.
I'm going to say that's a myth.
That is
You
a
got
myth.
it.
All right.
But you know what? A lot of people assume it's accurate. They really do. Social Security will send you a piece of paper making it seem like you really have to. It's not mandatory. You're eligible. So it's a big difference between those two. So people are working longer. They may not want to get Medicare. They might not need it. People do sign up accidentally, if you will, for Part A and B if you're funding a health savings account.
Okay.
Maybe you don't want to do A. So we really can tailor, to what's going on in your world. So it's not mandatory. So call people that know what they're talking about with this stuff.
Yeah,
we've just grazed the surface of some really important topics today. Tomorrow we're actually going to be at Schoolcraft College in Livonia at 10 a.m., 2 p.m., and 6 p.m. for Medicare University. So if anybody's local and they want to hear more about this stuff, we're going to be there all day tomorrow.
Yeah, nothing like the one-on-one conversation over the phone. So for more answers to your questions about Medicare, contact Senior Health Medicare by calling 888-404-5049 or visit their website, seniorhealthmedicare.com. We will post this information on our Live in the D Facebook page at clickondetroit.com, and we will be right back. Ladies, thank you so much.
Thank you.